And welcome back. And listen, we are pink all over. So, good morning, Jamie. We have, as promised, we told you earlier that we would have Jamie Aycock. She is you are the clinical manager of the UNC Nash Breast Care Center.
Yes, ma'am.
Okay. And important job. Very important job.
I like to think so.
Yeah, rewarding. It has to be a rewarding job. So tell us a little bit about the services offered by the Breast Care Center.
So I like to kind of think of the Nash Breast Care Center as a one-stop shop.
Yes.
We offer screening mammograms, diagnostic mammograms,
Okay.
breast ultrasound if needed. We do stereotactic breast biopsies, ultrasound-guided breast biopsies. We do Savvy Scout and needle loop placements for surgeries. So usually from the beginning to end, we follow our patients through.
Wow. Well, it's amazing to me how far technology has come in that. Used to, you just went in, got one kind of mammogram, and that shows how old I am. But anyway, you got one kind of mammogram, and that was it. Now, gosh, y'all can do such extensive work there.
We really can. We have the 3D mammogram machines, and that's really the most up-to-date technology for mammograms at this time.
Right.
We have some other things that we're possibly looking into in the future, but nothing for sure yet to help further along our services.
Right. Very good. Well, I hear nothing but good things about the Breast Care Center.
Thanks.
So, mammograms. How important is it, Jamie, that we get our mammograms?
It's extremely important. We suggest yearly mammograms for everyone. A lot of the doctor's offices have different guidelines they go by, so a lot of times they're requesting biannual mammograms, but we still go by ACR guidelines, and we are requesting that our patients still do their yearly mammograms. Because if you really think about it, if you had your mammogram 1 year and you wait 2 years before you have another one and something came up in that 1 year, that's a more progressive cancer than it would have been if you had came for your yearly
something
mammograms.
could start coming up right after you have the mammogram.
Exactly, and we have seen that happen.
And then there's 2 years almost,
Exactly.
of something that could have been prevented, helped, whatever. So, yeah, it's just so important to have them. Now, age. As you get older, is it still, what is the rule of thumb? Let's say 60.
So, ACR guidelines still say that you should still get your mammograms as long as you're able, up to like past 74.
Oh, wow.
It's really a personal choice. We tell our patients when we get asked, if you are willing and healthy and able, you should still come get your yearly mammograms, because as you get older, your risk increases.
Yes, sure.
So if you have other health conditions going on that would hinder your ability to have a mammogram, then you got more pressing things going on than breast cancer. So then that might be a factor in not getting your mammograms.
Sure.
Or if you ever reach a point where you're like, you know what, even if they found anything, I wouldn't have anything done about it.
Right.
Then you have reached that threshold where it's no need to keep continuing to get your mammograms.
Right.
But we do request that all of our patients get those mammograms and make sure that they stay up on their checks.
What if they say, because I've heard people say, well, I'm fine because I don't feel anything, I don't have any pain.
Well, that's what the mammogram is for. The mammogram finds things that you do not feel with your fingertips. A lot of patients do say that. They're like, well, I do my self-exams, I don't feel anything. Well, breast calcifications are like a type of breast cancer, possibly. Yes. There's benign calcifications, and then there are the cancerous type.
Right.
And a lot of times the cancerous type of calcifications are like the earliest form. And so if we can catch that on your mammogram, then you've saved yourself a lot of trouble and possibly a lot of treatment and other things. Because calcifications, if you think about those, they're like salt flakes.
Yes.
So they're not a mass. You're not going to feel those with your fingertips.
Well, some people have very dense breasts.
Exactly.
And so sometimes you're not going to feel it then.
That's right. And a lot of times people feel their dense breast tissue and they're like, everything feels lumpy. I don't know what I'm feeling.
Right.
And that's another reason for you to come and have a mammogram. With the 3D mammogram, it's like cutting through slices of bread, so it cuts through some of that dense tissue to
Yes.
increase your chances of the radiologist finding something if it's hiding in that breast tissue.
Right. So you said you walked through the whole thing to the end with your patients. So what if it's somebody that you have found breast cancer in? What then? After the mammogram and you have diagnosed, your radiologist has diagnosed, what then?
So after their screening, if they find something, they come back for the diagnostic. They've had their biopsy if needed. The pathology comes back as breast cancer. So at that point, our nurse navigators at the cancer center help that patient find a surgeon, an oncologist if needed. If they need breast MRI, they assist with getting that scheduled.
Right.
They really are very good about guiding the patient through the next steps, because when you are diagnosed with breast cancer, there's a million thoughts going through your brain.
Right, exactly.
So they
it's
kind of point
scary,
you.
and you need somebody to walk this with you, walk you through all of these,
Exactly.
this process.
That's true. So once they see their surgeon, they talk with their surgeon or their oncologist, they decide what the best action plan is for the type of breast cancer they have. And then once they've had surgery, went through their treatments, they would still come back to us normally for a follow-up mammogram or
Right.
ultrasound, just to make sure that nothing is growing or changing depending on what they have done.
Sure.
And some patients have neoadjuvant therapy at the cancer center. So a lot of times what that does is it will shrink a type of breast cancer. So
wow.
they send them back to us sometimes before they do surgery to see what the progress is of that.
Oh, wow. So Nash has state-of-the-art equipment, our
ma'am.
breast care center. I went over, and with the camera, when it was built, I was so impressed. We went over and filmed, and since then, a few years ago, we have done some more, well, we've done interviews, and I'm very impressed with the state-of-the-art equipment that y'all have in the center.
Yes, ma'am. We do, and we try to make sure that we make the patients as comfortable as possible, because we're not a fun department to visit, and
Right.
a lot of ladies shy away from their yearly mammograms. But our mammographers, they try to put the pink pad on the machine. That's a little cushion. It's not very thick, but it helps with the coldness of the machine, the compression a little bit.
Right.
We have the curved paddles. Now, the curved paddles do not work for every breast, depending on size and shape. So
Yes.
your mammographer would look at your breast and just decide if the curved paddle would benefit you.
Right.
And then we always try to do our updates on our machines. We go to conferences to see if there's anything new that we need to investigate.
So your technicians stay up to
Oh, yeah.
date.
Absolutely. We do CMEs, and they have to read up on different things, and they learn different techniques. And
Yes.
anytime we have a new mammographer come in, sometimes they can teach us something, sometimes we can teach them something.
Right.
So it's a give and take. We work together.
Very good, very good. Well, there's no reason, Jamie is telling us, there's no reason for us not to get our mammograms.
No, ma'am.
So if somebody is diagnosed, are there support groups
Yes.
out there?
The Cancer Center actually hosts a support group, and they usually meet the second Monday of each month from 6 to 7:30. The nurse navigators at the Cancer Center would be able to give more information about
Okay.
that. But that is one thing we do offer.
That's great. That is really good. Now, you have an event, I believe, coming up.
Yes, tomorrow we are hosting an event called Breast Intentions, supporting awareness and actions for a healthier future. And I'll be talking more about breast health, preventative measures, benign breast conditions, what you can look for in the breast that would warrant you to see your physician and have a mammogram sooner if there's an issue.
Well, that's really
All
good
that.
information right there.
Yes,
It
ma'am.
really is. So that's 11:30 to 12:30?
Yes, ma'am. That's going to be at the Nash Auditorium,
Okay,
and I believe they're providing lunch.
that's on the first floor.
That's on the first floor.
First floor. when
Yes,
you
ma'am.
Come in. I think I've been in there. 11:30 to 12:30. There's no reason not to go, ladies. So do they have to sign up, or can they just come?
I believe they can just come.
Okay.
I think they just come on in. They can ask the lady at the front desk where the auditorium is. They can kind of point them in the right direction. But it's a little area to sit
come
and
on.
listen.
Yes. Okay, and lunch is provided. So come on over 11:30 to 12:30, and let's hear what you're going to talk about awareness.
Yes, ma'am.
And,
Breast cancer
and all of
awareness.
those awareness and actions for a healthier future. So, and you'll be conducting that seminar, I believe, or that
Yes, ma'am.
little talk. Okay. Well, there's no reason not to go, ladies, if you want to go. And that's tomorrow. You said it was tomorrow.
Tomorrow.
Tomorrow's the 17th. I'm
The
trying to do
17th.
in my head that today is the 16th. It's getting away from us.
Yes, it is.
But anyway, so go on over and please do not hesitate to use our breast care center. I'm telling you, it is state of the art. And I hear good things all the time about the girls in there, and the staff is just wonderful. So please do not hesitate. And we do have surgeons right there that can
Yes,
help
ma'am.
you, can take care of you if something were to, if you were to need it. So thank you, Jamie, for being on this morning.
Oh, you're welcome. Anytime.
Very, very good information about our breast care center right here at UNC Health Nash. We'll be right back right after this.